Okay. I don't need this. I was waiting to see if any of my colleagues were coming out. Good afternoon. Thanks everybody for being here today. We're here today because in the course of a single week, our community has gone from moderate to high rates of transmission of COVID. Helen Eddy will talk more about what exactly that means, and what it means for me is what we are going backwards. It means that our community is at risk for unnecessary deaths and hospitalizations. It means that our children are at risk as they go back to school. It means that our hospitals are at risk for not being able to care for everyday illness and injuries. And it means that our business are at risk again. I'm really struggling to understand how we have collectively let ourselves slide back to this level of risk. We have safe and effective ways to put COVID behind us, and yet there is a segment of people who have made the decision that they are not responsible for the health of our community. They have decided that this is an acceptable level of deaths in our community. Those deaths include someone's great-grandparent, parent, a coworker, a friend, a neighbor. When is enough enough? We know there is a small percentage of people who can't get vaccinated for medical reasons, but for those who have made the choice to not get vaccinated, what will be the tipping point in number of deaths that you're willing to accept? And here in Polk County, we have lost over 600 lives to COVID, and I personally cannot accept one more. It is time for everyone to do their part. Get vaccinated or wear a mask, period. Here at Polk County, we are requiring our employees to provide proof of vaccination. If they are not vaccinated or do not show proof, then they are required to wear a mask, and it will be enforced. We encourage other businesses and organizations to do the same. Helen will expand on the current CDC recommendations, but it is because we do not have yet high enough percentage of people vaccinated to prevent the spread of COVID variants. This unvaccinated pool of people are also leaving open opportunity to create another variant, one that might be resistant to the vaccine or one that might be more deadly. As we start to see more large gatherings such as concerts, the state fair, back to school, this is really a perfect storm. We have done everything we can to get people vaccinated with incentives, continuous media and outreach campaigns, just to get the vaccine. If you are on the fence, at the very least, have a conversation with your family doctor about the safety and efficacy of the vaccine. Just ask the question to your doctor. If you're on the fence, just please ask your doctor. Ask your parish priest, ask your pastor, ask somebody that's had COVID. And now I want to turn it over to Helen Eddy and to discuss how we arrived at this point.
Well, thank you, Angela. While we may be done with COVID, COVID is not done with us. The CDC recently provided definitions for the rate of community transmission and guidance based upon those definitions. These definitions utilize the rate of new cases per 100,000 and percent positivity in the last 7 days. If the two indicators suggest a different transmission level, the higher level is selected. The CDC designated Polk County at high risk for transmission of COVID-19 virus just today around noon. It's moving quickly, as Angela indicated. Currently, the rate per 100,000 for the last 7 days in Polk County is 66.1 cases per 100,000, and we are at 10.32% positivity. COVID-19 is spreading because more Polk County residents need to be vaccinated and mask usage has waned. The Delta variant is driving a rise in cases and hospitalizations, and it is time for the residents of Polk County to take action. First, if you are unvaccinated and eligible for vaccination, get vaccinated now. I can't say it any more plainly. Get vaccinated now. There is no reason to wait. A COVID-19 vaccination will protect you, your family, and those in our community who are vulnerable and unable to be vaccinated. We will be sending over 41,000 children who are unable to be vaccinated back to school in a few weeks. While Polk County's immunization rate remains among the highest in the state of Iowa, it remains below the CDC recommended level of 70 to 75% needed for community immunity. Get vaccinated if you are eligible and help us reach our goal and protect our community. If you remain unvaccinated, you will get COVID. The only question is how sick you will become. Second, we ask all residents of Polk County to follow CDC guidance, vaccinated or unvaccinated, and start wearing their masks in indoor public places again. Wearing a mask protects you and others and helps to stop the spread of the COVID-19 virus. Individuals should wear masks in indoor public spaces. We also ask you to remember to wash your hands and stay home when you're sick. All of these measures together can help us stop the spread of COVID-19. Our only agenda is the health and safety of the residents of Polk County. We are asking the residents of Polk County to step up, get vaccinated if you can, and put your masks back on. We need your help. This is how we combat this latest surge of COVID-19. We must do it together, as a community, and for each other. Thank you.
Thank you all for having me here today. I'm Dr. Afroz, one of the infectious disease physician, and I'll tell you a little bit about the Delta variant that you just heard about. It is the most common variant that's prevalent globally in the United States, in our state, in our county. 95% of the cases are because of Delta variant. And why is it so important? Because of its easy transmissibility. Why is it spreading so fast? It's because it's transmittable very easily. If you're sitting beside somebody who's carrying this virus and you're unmasked, then you're sure to inhale this virus and get sick, especially if you're not vaccinated. The amount of viral load in the body, if somebody gets infected with Delta virus, is more than 1,000 times what we had when we had the original Alpha virus. So that is the reason why it's so easily transmittable. Coming to vaccine, yes, vaccine still works for this Delta variant. It's not as high as 95% effective, but it is 85% effective. Something is better than nothing. Talking about treatments, we are losing some of the treatments to this variant. You've probably heard about monoclonal antibodies. The first one that came out was bamlanivimab. It doesn't work for this variant anymore. It was used for people who had mild to moderate disease. We are left with just one monoclonal antibody now in the market that we can use for these patients who get sick. And in my institution, in the last 4 months, we had about more than 200 patients, and 95% of them were not vaccinated, and 4% succumbed to this illness. So it is real, and in order to prevent hospitalizations, in order to prevent deaths, vaccination is very important. Prevention is very important. You just heard the CDC guidelines. It's very important to adhere to all those things. And talking about age groups, we are seeing more and more younger patients now in our hospital. 60% of the patients were less than 60 years old in past 4 months in my institution. So the population of patients have shifted from the older, the immunocompromised, to the younger, unvaccinated patients. So we have to keep that in mind. Vaccines do work, and please get yourself vaccinated and mask when you are out of your house among people who you don't know if they're vaccinated or not, and especially indoors. Thank you.
Hi, I'm Tracy Eckhart, the Chief Medical Officer for Unity Point Health Des Moines. At our hospitals, we were down to 7 patients total with COVID in all 4 of our community hospitals as of 2 weeks ago. We've seen the same surge that everyone else is seeing. We had 19 patients admitted just over this weekend, including our first pediatric patient that we've had in 4 weeks. I'm a pediatric intensive care physician and was in our ICU and ED over the weekend. We are seeing a significant rise in pediatric patients as well in our ED department. We know that the only way to fix this and to combat it is vaccinations. We had Blank Children's Hospital was built as a polio hospital. We don't treat polio anymore. I haven't seen polio. We haven't treated polio in 50 years because of vaccination. And that is the only way we are going to get through COVID and keeping it from controlling our communities. Strongly encourage anyone who is unvaccinated, A, to be vaccinated, and B, wearing masks, especially as we're going back to school. 2 and over, anyone unvaccinated, and we know everyone under 12 cannot be vaccinated, to have everyone wearing masks in our community to keep all of our community members safe.
Good afternoon. My name is Nicole Gil-Gashiani. I am the Chief Physician Quality Officer for Broadlands Medical Center and a family physician. My colleagues have laid out the situation currently and how it is worsening every day. We are very united on encouraging all patients that are eligible to get vaccinated. I know there are a lot of concerns in the community about whether or not the vaccine is safe. I can tell you there are very few opportunities in medicine to have tried a medication or a vaccine or any treatment option with this number of people that we have been able to vaccinate. These vaccines are incredibly safe. There are side effects which have garnered a lot of attention, but they are usually very fleeting and only last a day or two. The vaccines are also incredibly effective. They work. They continue to work against the Delta variant, which is prevalent right now. As was mentioned, if the virus continues to circulate, we are not sure if they will continue to work against future mutations, which is why it is so important, and we plead with you today to do everything that you can to try to curb this pandemic. Nothing is perfect. We are not saying the vaccines are perfect. We are not saying that wearing a mask is perfect, nor washing your hands is perfect. However, all of them together lower the risk and help protect our community. And we are asking everyone in the community to reach out. We are in this together, and together we can move forward.
All right, I want to thank everybody for coming today. Does anybody have any questions for any of our experts here that were here today?
You know, something I see a lot, or have been seeing a lot, and I don't want to sound crass here, but a lot of people are saying this. They're saying, I got the vaccine, I did my part. Why should I have to continue to make sacrifices for the sake of the unvaccinated?
By wearing a mask?
A lot of people are saying that.
Well, I think it's for the safety of our community as a whole, and for our kids that are going, the 41,000 kids that are going back to school, and for everybody else that may not be able to get vaccinated because of, for whatever medical reason they can't get vaccinated, and for our businesses that have shut down. We don't want that to happen again. I think that's a small price to pay to wear this little mask that really is not a huge sacrifice in my opinion. I don't want to wear one either, but you know, everybody just get vaccinated and maybe we don't have to wear these for much longer. But the rate we're going, it's going to be a while unless we get vaccinated.
Is Polk County partnering with any businesses to urge them to reinstate mask policies?
No, we don't have the authority to do that. I'm encouraging all businesses to follow the lead of and follow the science as CDC guidelines state. If you need to wear a mask. I mean, I think that's clearly what the CDC guidelines say is wear a mask. We're in that high, not moderate, not low, but high transmittable rate now, so everybody should be wearing a mask indoor.
Is it your hope that then business owners would start putting those signs back up saying wear a mask indoors, mandatory, all employees, things like that?
That's correct. Follow the CDC guidelines. that's what we want.
Do you all have an estimate of how many Polk County employees are vaccinated at this point? I know you mentioned the mandate.
We've had about, in May, there was about 65%, so we're going to get another estimate in the next week or so.
Do you folks have very recent hospitalization totals and trends for the last few weeks for the Polk County hospitals? Do you have those?
44. Yep, I know we have 27 inpatient right now, one pediatric.
Yeah,
37
at
adult.
Unity Point.
Yep.
The hospital metro area has 44.
Yeah,
As of today,
total.
as of today. And that is over double what we had a month ago.
44 COVID patients today.
Yes,
We've tripled in the last 2 weeks.
And that's for all the Des Moines hospitals?
Correct.
Just a note on the schools, obviously, Polk County Health doesn't have authority over, and schools can't make the decision to mandate masks. What would you encourage, I guess, parents to do in terms of sending their kids off to school?
If they are 12 and up, I would encourage them to get vaccinated. And anybody under 12 that's not eligible to get vaccinated, I would encourage them to wear a mask for the safety of everyone in the school, teachers, staff, students, and use any other mitigation that they can possibly do, because I know they can't require them to wear a mask, but any other mitigation, wash your hands, just what they have talked about. And I know that Helen and her staff are working with the schools to help with other mitigation standards. It's really going to have to be up to the individual parents to talk to their kids about what they think they need to do.
Helen,
Here, we've got an answer.
No, I was just gonna say, I think that might be a potential response to vaccinated people as well, in terms of, why do I have to do this? Again, we know the vaccine is not perfect. It was never thought to be perfect when it was designed. It's to lower your risk. So while rare, it is still possible that even though you're vaccinated, you could still get COVID-19. And particularly when it's this prevalent in the community, that risk is going to be much higher. And so I think, again, to your point, when we talk about schools, everybody in the community has a role to play in that, both vaccinated and vaccinated, kids and not kids, because anyone that gets infected is going to then have the chance to spread it to lots of other people that could bring it back into the schools.
Thank you for that. That's why she's the expert.
With 44 patients right now, what's capacity looking like moving forward at the hospitals?
No. I can say that even without COVID, we are stretched. We are full. In pediatrics, we have RSV, and I was on all weekend, and we are full. In the adult side, same thing. So having a COVID surge on top of this, you can just imagine what it does when the hospitals are already stretched, adding COVID patients on top. So it is something we're watching very closely, because we're stretched for beds, we are stretched for nurses, we are stretched for respiratory therapists, all the things we need to care for COVID patients.
Dr. Eckhart, anecdotally, what are you hearing from some of the families who are coming in at this time and, oh my gosh, I didn't think I'd get it?
I know I'm going to actually defer that to someone who works more with the adult side. Yes.
At this time of the pandemic, I don't think we can say, I didn't think I would get it, because the transmission is, among kids, among adults, among healthy, among people who are sick, immunocompromised, not immunocompromised, anybody can get sick. So yeah, I've heard that too several times, especially when you ask patients who come to the hospital and you ask, hey, why didn't you get yourself vaccinated? That's the thing that we hear. Hey, I didn't think I would get it. But with the amount of patients we had, the surges we had, all through this 1.5 years, I do not think anybody can say that, how did I get it?
Are you all hearing regret from people who didn't choose
Absolutely, absolutely. Once they get hospitalized, we just educate them. We kind of talk about the myths and the misinformation that they have. We try to clear that up. And especially people who are COVID hospitalized, we give them information. Once you feel better, go get yourself vaccinated. I mean, there's no duration anymore, right? In the past, we said, okay, get yourself vaccinated in 90 days. No, nothing like that. You get COVID, you feel better, you think about getting yourself vaccinated. People who have come for other things in a hospital, if they are not vaccinated, we are now vaccinating in the hospital. We give their first shot, we give them information, we say, go to your primary care physician on this date, around this date, get your second shot. So we are vaccinating people now in the hospital. They are admitted for other reasons. And of course, COVID positive patients, once they get discharged, we tell them, the moment you start feeling better, go get yourself vaccinated.
Have people been saying where they're getting that misinformation from, the sources of that?
Oh, there are a lot of sources. I mean, like, I don't even want to go there. There are a lot of sources.
How do we combat this? I mean,
Education. I think education, reinforcement, each and every primary care clinic visit, media, the place where they find misinformation, they should start sharing some good information. I mean, education, and, just that's the most important thing. At this time, we all are tired. We all are tired educating people. I am just tired speaking about vaccine each and every day. I am just tired about hearing the excuses that people make. I don't think I would get it. Well, when are we going to think about the community? When are we going to think about the spread of virus so rapidly among everybody? Whether you get the disease or not, there's so many people spreading this around.
do you think that there's been a lot of misunderstandings about the breakthrough cases?
Yes, definitely. There's a lot of misunderstanding about, as Dr. Gilgit mentioned, nothing is perfect, right? Vaccinations are not perfect. So yes, there are breakthrough cases. Most of the breakthrough cases, people are, either they have mild to moderate COVID. They don't get severely ill. They don't get on the ventilator. The mortality in breakthrough cases is very, very low. So yeah, that is also misinformation out there that we just need to reinforce and educate people.
How concerned are you about big public events, including the state fair, bringing people into this area from all over the place?
Very concerned. Especially with the way the virus is spreading, the easy transmittability of the virus, very concerned among these, fair and whatever group events that go on.
Should rules be put in place?
Absolutely, I think so. I think rules such as vaccination or proof of vaccination or masking. Some of the events, I've just read this, that they are also requiring a negative COVID test within 72 hours. I don't know how many places that can be mandated, but proof of vaccination or a negative test within 72 hours or masking yourself are the best things. Thank you.
Thank you. Okay, I think the message today is get vaccinated. What do you guys think? So that's it. Any other questions? Otherwise, thank you very much, and I hope the next time you all come, you got positive news. And I don't mean positive numbers. Thanks, everybody.